All right, so welcome everyone to the Hemophilia Council of California's Advocacy and Policy webinar. My name is Elaine Kintz. I'm the Executive Director of the Hemophilia Council of California and wanted to welcome you to the California Children's Services What You Need to Know webinar that we are hosting this evening.
So what does CCS cover? CCS covers doctor visits and care, hospital stays, surgery, physical therapy and occupational therapy, tests, x-rays, medical equipment, and medical supplies. Also medical case management to help get the right doctors and refer you to other agencies if needed, such as public health nursing and regional centers. And additionally, case management also encourages youth members to start thinking about how they will take responsibility for care as they approach 21 and who will provide their care and how will their care be covered after they turn 21. CCS also has a medical therapy program, which provides physical therapy and/or occupational therapy in the public school. CCS provides travel assistance to get to appointments if needed. And so about the travel assistance, just a little note about that. If you need travel assistance, call your county CCS program with as much advance notice as possible. If you live in a whole child model county, which I'm going to explain what that is in a couple slides. But if you live in a whole child model county, travel assistance is provided through your managed care plan. So you'll call a managed care plan for travel assistance in those counties. Travel assistance can include mileage reimbursement, a gas card, bus ticket, or even something like Uber. It can include a small reimbursement for meals, parking, tolls. Make sure that you save all of your receipts. And if you live far enough away from your special care center that you need to spend a night nearby in order to attend your appointment, then you can get assistance with lodging too. If you do need lodging, ask your hemophilia treatment center social worker to put in a request for the family house or Ronald McDonald House if the hospital that you go to has one of those. Those are really great resources for if you need travel assistance. And then just one more final note about what does CCS cover. Just be aware that each service has specific criteria for approval, and it must be medically necessary to be approved, and everything needs to be approved in advance. So you just want to have good communication with your local CCS program or the managed care plan if you're in a whole child model county.
And I do want to briefly thank all of our sponsors that make this webinar series possible. We have Takeda, Sanofi, BioMarin, Novo Nordisk, Pfizer, the Hemophilia Alliance, and CSL Behring, who help support these presentations. So thank you so much, Meredith, for your time. Again, if you guys have follow-up questions or like specific individual situations that you need assistance with, don't hesitate to reach out to us. And you know, Meredith is specifically there in Humboldt County, but sometimes if I get a particular sticky CCS question, even if it's in a different county, I will call her, and she knows a lot of folks in other counties too, so she can help. She helps us navigate those on occasion. Thank you so much for joining us. We'll see you next month. Bye-bye.